Now let us see the topic of antimicrobials. So these are the drugs or agents which are used against the microorganisms. So antimicrobials are the agents, or antibiotics are the agents which are the chemical substances or the drugs which are used against the activity of the microorganisms. So these microorganisms or these antimicrobials, before the antimicrobials are discovered, so a lot of people died because of the various infections which are caused by bacteria, viruses and various other microorganisms. But after the discovery, the death rate or the mortality rate has been reduced because of the treatment by these antimicrobials. But now the bacteria or the microorganism, they became resistant to these antimicrobials, and thereby these drugs are less useful. So what are the various types of antimicrobials used? So there are various drugs like antibacterial agents which are used against bacteria, antifungal agents which are used against fungi, antiprotozoal agents used against protozoa, antiviral agents which are used against virus, and anti-helminthic drugs. Now, what are the features of these antibiotics or antimicrobials? So they should have selective toxicity. So these antimicrobials, they have selective toxicity in the sense they cause toxic to the microorganism than to the host cell. So if we are taking the antimicrobials, that drug should not cause any toxic to the patient. That should cause only harm to the microorganism. So here the chemotherapeutic index. So chemotherapeutic index is a characteristic, or else we can say it is a measure where the lowest dose toxic to the patient divided by the dose which is typically used for therapeutic effect. So here, if we are taking that medication, that should cause more therapeutic effect than the toxic effect. So if we see the antimicrobial should have selective toxicity. So here it should have it is having efficacy as well as toxicity as well, but it should be it should be efficient to the patient and it should be toxic to the microorganism. And chemotherapeutic index is the ratio of toxic dose to the therapeutic dose. So it should have antimicrobial action. So here the antimicrobial action can be bacteriostatic or bactericidal, or microstatic or microbial static or microbial-cidal. In the sense here bacteriostatic in the sense it inhibits the growth of microorganisms, and bactericidal in the sense it will kill the microorganisms. It should have both these characteristic features. Spectrum of activity. So what is the spectrum of activity? So there are few antibiotics or antimicrobials which are used only to treat limited infection, in the sense that the infection which is caused by microorganisms. But broad spectrum of antibiotics are those which are used to treat infection which is caused by various microorganisms. So here, based on the activity or range of the activity, these are divided into broad spectrum and narrow spectrum. Effects of combination. So if we are combining two antibiotics, then it shows two types of effects: synergistic effect and antagonistic effect. So synergistic effect in the sense they both show more antimicrobial effect, or show on combination of these two drugs they show more antibiotic effect. And the antagonistic effect is nothing but one drug will antagonize or it will oppose the action of the other drug. And adverse effects. So if the antibiotics are used in higher doses, or if because of the overdosing of these antimicrobials, it may lead to various allergic reactions. Like some people may develop hypersensitivity or allergic reactions to antibiotics. So here we can see the amoxicillin rash. So few people have rashes because they are not tolerable, or the amoxicillin antibiotic cause this type of allergic reactions. And toxic effects. So some microbials have toxic effect at higher concentration. So if we give these antibiotics at higher concentrations, these may produce the adverse effects. And suppression of normal flora. So these antibiotics even kill the normal bacteria which are present in our body. So in our intestine there is the bacterial flora which is useful for the body. So these antibiotics, they even kill the normal flora, thereby the infectious causing microorganisms will develop easily. and resistance. So some microorganisms, they develop resistance towards the antibiotics. So here, for suppose if we give one antibiotic, so they are acting against the microorganism, and if we give the same antibiotic the other time, they are not that effective towards the microorganism. Why? Because this microorganism has changed its structure, has changed its gene expression, whereby the antibiotics are unable to identify the microorganism, and thereby they become resistant. And other can develop resistance through spontaneous mutation. As I said, they change their mutational structure or gene expression, and thereby these microorganisms, they become resistant to antibiotics. So an ideal antibiotic should have the following characteristics, like it should have selective toxicity. So it should be toxic to microbe, not to the person. And it should be soluble in body. So should be easily soluble in body, thereby it is distributed widely and it even crosses blood-brain barrier. And it should be remained in the body long enough so that it can treat the microorganism causing infection. So it should be long enough. It should have that particular duration to treat the infection. So before treating its infection or before killing the microorganism, if it's getting eliminated out of the body, then that is of no use. And shelf life. Shelf life in the sense it is a time taken for a compound to resist against the microorganism. So here this is the shelf time. So the antibiotics should have proper shelf life. They should not lead to resistance. So they should not cause any resistance to microorganism, and they should be cost effective, and they should not cause any allergic reactions, and it should be microbicidal rather than microbiostatic. In the sense, it should kill the microorganism rather than inhibiting the growth. So for suppose if a antibiotic is microbicidal, microbistatic, so it is inhibiting the growth for now. But once we stop taking antibiotics, the microorganism can grow again. So here we need to kill the microorganism instead of inhibiting its growth. And the suppression of normal flora. So the suppression of normal flora like Clostridium difficile and Candida albicans. So these may be, the normal flora may be inhibited by this, by the antibiotics which are used against these microorganisms. So now let us see the mechanism of action of these antibiotics. So there are various mechanisms of actions by which they inhibit the microorganism growth or they kill the microorganism. Like they inhibit the cell wall synthesis, inhibit protein synthesis, inhibit nucleic acid synthesis, injury to the plasma membrane, and inhibit the synthesis of essential metabolites. So here they are inhibiting the synthesis of essential metabolites. And if we see here the mechanism of action, so the antibiotics like beta-lactams, like penicillin, cephalosporins, monobactams, vancomycin, bacitracin. So these are all the antibiotics which are inhibiting the cell wall synthesis. So they won't allow the cell wall of the microorganism to develop. So if the cell wall is not developing, the microorganism won't live. And nucleic acid synthesis, so they inhibit the folate synthesis. The drugs like sulfonamides and trimethoprim, and quinolines are the one which inhibit DNA gyrase, and rifampin is the one which inhibit the RNA polymerase. And the drugs like macrolides, clindamycin, linezolid, chloramphenicol, streptogramins, and tetracyclines and aminoglycosides. So these are all the drugs which inhibit the protein synthesis. Now, let us see how the cell wall synthesis is inhibited and what are the drugs which are involved in the mechanism. So, beta-lactam drugs. So, beta-lactam drugs which includes penicillins and cephalosporins. So, these penicillins and cephalosporins, they contain beta-lactam ring in their structure. So, they irreversibly inhibit the enzymes which are involved in the final step of cell wall synthesis. So, in the cell wall synthesis, various steps are involved. So, whatever the final step which is there, so whatever the enzymes which are involved in the synthesis of this cell wall, that will be inhibited by this beta-lactams. Thereby, they will prevent the growth of the, thereby they inhibit the growth of the microorganism. And this beta-lactam, they have the structure which is similar to that of the enzyme. So whatever the enzymes which are there, which are involved in the cell wall synthesis, this beta-lactam, they have the similar structure, and thereby they will bind as a substrate to that enzyme, and the enzyme mistakes these beta-lactams for the substrate, and thereby the enzyme inactivity is inhibited. So some bacteria which are there, they produce the beta-lactamase enzyme. So few bacteria, they produce the beta-lactamase enzyme, and thereby the beta-lactam ring is broken. So in such kind of bacteria, these beta-lactam rings are resistant, and the beta-lactams include penicillin and cephalosporins. So here we can see the structure of penicillin and cephalosporins. They are having a ring structure. One is which is having 4 carbon atoms, and the other one is having which is having the 4 compounds, that is 3 carbon atoms and 1 nitrogen, and which is having the 5 compounds, again the 3 carbon atoms and 1 sulfur and 1 nitrogen. So this completely constitute the beta-lactam ring. And if we see the mechanism of action of penicillins, so here the penicillin binding protein is there. So this penicillin binding protein, what does it do? It will inhibit the enzyme, or else it will inhibit the enzyme which is responsible for the cell wall synthesis, and thereby it won't allow the formation of the enzymes, or it won't allow the formation of cell wall and the inhibitors. We can see some structures which are there. So these are the inhibitors which won't allow this penicillin protein binding to induce the enzymes which are involved in the cell wall synthesis, and thereby the synthesis is inhibited. So if we see penicillins, these are acid labile. So they contain the structure which is having acid labile, and they are very effective against gram-positive bacteria. They are having large volume of distribution. So they are widely spread, they are easily soluble in water, but the penetration is very poor in brain. So in the brain, they can't penetrate so easily, and thereby the infection which is caused to meninges, that cannot be treated with penicillins. And there are broad spectrum penicillins like amoxicillin and ampicillin, which are very effective against gram-negative bacteria. So if we see the penicillin mechanism of action, so transpeptidase is an enzyme, one of the enzymes which is involved in the cell wall synthesis. So this penicillin, it contains beta-lactam ring. So this beta-lactam ring will bind to the enzyme instead of the substrate molecule, and thereby the enzyme activity is inhibited and the reaction is not taking place. In the sense, the cell wall synthesis, the proteins which are involved in the cell wall synthesis are inhibited. The other drug is flucloxacin. So flucloxacin is indicated in the infections which are caused because of penicillin is producing penicillin resistant. So here penicillins they get degraded with the presence of an enzyme called penicillinase. So this penicillin resistance, in the sense the microorganisms which are resistant to penicillins, for example the staphylococcus species. So in such conditions the flucloxacin drug is very effective. So what it has a mechanism of action like, so the R1 group. So if we see here the structure of the penicillins or cephalosporins, they contain R1 group, R1 compound in their group. So here the R1 is nothing but the isoxazoline. So the isoxazoline group which is present in the flucloxacin, it forms an intermediate compound with the enzyme, and thereby it is preventing the cell wall synthesis. And it is less effective when compared to benzyl penicillin, and it is well absorbed orally. So when given through oral route, it is well absorbed, but in severe infections, it should be given only through IV route. And the Staphylococcus aureus like species, they are resistant strains to fluoxacin. So Staphylococcus species, whatever are there, they become resistant to fluoxacin and methicillin. So in such conditions, these are not effective to treat the infections which are caused because of the Staphylococcus. Let us see the broad spectrum penicillins. So broad spectrum penicillins include amoxicillin and ampicillin. So these are very effective. These are very effective, and they are non-beta lactamase rings. So they don't contain beta lactam in their structure, and thereby they are very effective against gram-positive bacteria, and very active against many strains like E. coli, Escherichia coli, and hepatitis influenza, salmonella, typhimurium. And these are very absorbed orally. Mostly they are given through oral route, and amoxicillin is having better absorption when compared to ampicillin. So these are ineffective against penicillinase resistant resistant species, in the sense if a microorganism is resistant to penicillin, in the sense if the microorganism release penicillinase enzyme and the penicillins are getting degraded. So in such conditions these drugs are very effective because penicillins contain beta-lactam ring. So here penicillinase, it breaks the penicillin at the beta-lactam ring. So as these are non-beta-lactam, as these don't contain beta-lactam rings, they are not, nothing happens if the penicillinase or beta-lactamase releases by the microorganism. So many bacterial beta-lactamases are inhibited. So beta-lactamase enzymes are inhibited by the drugs like clavulic acid and amoxicillin. So this combination is very useful in order to inhibit the beta-lactamase ring, and thereby they are showing better antibiotic effect in penicillin resistant species. And this combination of cloamoxiclave, it is very useful to treat respiratory as well as UT infections. Now the other type of the beta-lactam rings are cephalosporins. So cephalosporins, these are used to treat the infection which is caused to meninges and pneumonia and septicemia. And it is having, so as these also contain beta-lactam ring, only they have a small functional group change. So they are having the same pharmacology of that of penicillins, and these may have allergic reaction and cross-reactivity to penicillin. So if we give the cephalosporins in combination to penicillin, that may produce the allergic reactions. And these are also having the similar activity when compared to penicillins. So if we take few of the cephalosporins like citidroxil, which is used against UTI infections, and cefuroxime, which is used as a prophylactic agent in surgery, and it is used as, it is resistant to inactivation by beta-lactamase. So this is one drug which is not inactivated by the beta-lactamase enzyme. And ceftazidime, it is used as a wide range of activity for gram-negative bacteria. So this is a wide spectrum cephalosporin. It is used against a wide range of bacteria, even with the species called as Pseudomonas aeruginosa, and it is used to treat even the meninges infection because it can easily cross through the blood-brain barrier. The other drug is vancomycin. So vancomycin is not well absorbed orally. So if we give it through orally, it's not well absorbed. So it has to be given through IV route, and it inhibits the peptidoglycan formation. So peptidoglycan is an important compound which is aiding in the cell wall synthesis. So this compound process or this compound formation is inhibited by this vancomycin, and it is very effective against gram-positive organism. And I told you MRSA, that is methicillin resistant Staphylococcus aureus. So the drug methicillin, it is resistant with Staphylococcus aureus species. So the resistance which is caused by this drug, that can be treated with the IV formulation of this vancomycin, and it is used to treat pseudomembranous colitis. And here if we see the mechanism of action, here the vancomycin, it binds to the amino acids which are there, and thereby it is preventing the peptidoglycan formation. So the peptides and glucose, they are combining together to form the cell wall. So this action is inhibited by the vancomycin, and it binds to the amino acid chain which is present in the cell, which is involved in the cell wall synthesis. Now let us see the inhibition of protein synthesis, how the protein synthesis is inhibited by these antibiotics. So here the bacteria mainly targets the ribosomes, because the ribosomes are the structures which are involved in the protein synthesis. So here the antibiotics which are used which are involved in this mechanism are aminoglycosides, which mainly bind to 30S subunit. So these ribosomes, they contain 50S subunit and 30S subunit. So these aminoglycosides, they bind to 30S subunits of ribosomes, and thereby they won't allow the ribosomes to aid in the protein synthesis. And tetracyclines are those which also bind to 30S subunit, and they also even bind to tRNA, that is transitional RNA or transfer RNA. And macrolides are those which binds to the 50S subunit, and thereby they are preventing the protein synthesis. So now let us see the aminoglycosides. So aminoglycosides are the antibiotics which are very effective against both gram-positive as well as some gram-negative bacteria. And these are having narrow therapeutic index. So the dose of these aminoglycosides should be monitored, because if we increase the dose, it may lead to adverse effect, and if we decrease the dose, it may lead to no effect. So they show a side effect called as there will be the toxicity to the 8th cranial nerve. So 8th cranial nerve which is present, that may lead to toxicity of the nerve and it may cause kidney damage. So if we see the aminoglycosides which are acting against various infections are gentamicin, which is used against acute life-threatening gram-negative infections, amikacin, which is used against the bacteria that are genetically resistant, and or else which are resistant to gentamicin as well, and neomycin, which is used topically for skin infections, any skin related infections, and orally to sterilize the bowel before surgery. Before surgery, if there are any infections, or if there, in order to sterile, or in order to clean the stomach from infections or microorganisms, this neomycin is used orally, and streptomycin, which is used against Mycobacterium tuberculosis, and rifampicin, which is also used against Mycobacterium tuberculosis to treat the tuberculi. The other drug is chloramphenicol. So chloramphenicol is a broad spectrum drug. So this is used against various microorganisms, and it is having a serious side effects like bone marrow aplasia. So it will cause damage to the bone marrow, thereby it is preventing the formation of the blood cells. And encephalopathy. And encephalopathy is a condition where the brain functioning is not proper. And optic neuritis, this is a condition where the inflammation of optic nerve takes place. It is having the large volume of distribution including CNS, in the sense it is even distributed in the CNS very well, and it inhibits the action of other drugs, and it increases the action of phenytoin, sulfonylureas and warfarin. So this chloramphenicol, we saw the drug interaction with chloramphenicol. So it will allow, or else what does it do? It potentiates the action of the drugs like phenytoin, sulfonylureas and warfarin, leading to this adverse effects of these drugs, and it causes grey baby syndrome. Now let us see the drugs which inhibit the nucleic acid synthesis. So here nucleic acids are the compounds which are involved in the DNA synthesis. So these are the antibiotics which target the enzymes which are required for nucleic acid synthesis. So they inhibit the enzymes which are aiding in the nucleic acid synthesis. So the drugs include fluoroquinolones, which inhibit the enzyme that maintain the supercoiling of closed circular DNA. So here if we see the DNA strands which are there, they are bind together with nucleic acids. So here the nucleic acids are not present, then the DNA binding or DNA formation won't take place. So the supercoiling which is involved in the DNA, so the nucleic acids which are involved in the supercoiling of the DNA, that is inhibited. And rifamycins, which block the prokaryotic DNA dependent RNA polymerase during the transcription. So here when the RNA is converted to DNA during this transcription procedure, whatever the enzymes are involved, that will be inhibited by the rifamycins. Let us see sulfonamides. So fluoroquinolones are nothing but the sulfonamides. The sulfonamides include sulfadiazine, which is well absorbed orally. It is having good oral absorption, and it is used to treat against various urinary tract infections. But this sulfonamides, they are not that active against Escherichia coli, because these E. coli are resistant to these sulfonamides, and these are less toxic. These use less toxic drugs when compared to other drugs, and these are having various adverse effects like Stevens-Johnson syndrome. This is a serious allergic reaction to skin, and it causes skin rashes and fever. The other drug is trimethoprim. So trimethoprim is used against various UTI infections and respiratory depression, and clotrimazole, which is a combination of trimethoprim and sulfamethoxazole, and it is used against pneumonia and toxoplasmosis. The other drugs are quinolones. So quinolines are those which inhibit the DNA gyrase enzyme. So DNA gyrase enzyme is an enzyme which is involved in the new DNA synthesis. Here if we see two strands of DNA are there. So these two strands, they break, and thereby this new strand or whatever the breakdown strand is there, it will develop a new strand, and thereby the DNA synthesis is done. So DNA gyrase is an enzyme which is involved in the breaking of the DNA strands, and thereby this, if we inhibit the DNA gyrase enzyme, then the new DNA synthesis is inhibited. And the nalidixic acid, so nalidixic acid is a quinoline compound which is used against UTI infection, and ciprofloxacin is very effective against both gram-positive as well as gram-negative bacteria. So these quinolines, they are well absorbed orally. So here if we give either through oral route or IV route, they get well absorbed into the circulatory system, and they are eliminated through kidneys unchanged. So they are not undergoing any metabolism. So that is the reason how they enter into the body. In the same way, they are excreted out of the body. They are having the common side effects like headache, vomiting, nausea, but convulsions are very rare. So the convulsions characteristic side effect is very rare that happens only with the toxicity of the overdosing or toxicity of the quinolines. The other drugs are 5-nitroimidazoles. So 5-nitroimidazoles are having wide spectrum. So they are used against various bacteria or various microorganisms. So metronidazole is a drug which come under this category and which is used against anaerobic bacteria. So these are the bacteria which even respirate or which even reproduce, or they can divide without any oxygen. So in that condition, this metronidazole is very useful, and it is used against protozoan infection also. And tinidazole is a compound which is having longer duration of action. So once it is administered, it is having its effects for longer period of time, and thereby it is showing the antibiotic effect. So here if we see the mechanism of action of these, so here these organisms, they contain nitro group. So they have nitro group in the structure, and this nitro group, it will react with the bacterial enzymes, and thereby it is forming a chemically inactive compound. So here if the chemical, if they are reacting with the bacterial chemicals and they are forming inactive compounds, and thereby they inhibit the DNA synthesis. So they make the enzymes which are there inactive by reacting with those enzymes. So now let us see the other mechanism of action. There are few antibiotics which cause injury to the plasma membrane. So whatever the plasma membrane of the cell is there, that cell plasma membrane will be injured. So here these drugs, whatever the drugs are there, they bind to the membrane of the gram-negative bacteria and alter the permeability. So here these drugs, they will bind to gram-negative bacterial cell, and thereby they won't allow the other organisms or other compounds to diffuse. So whatever the cell contents are there, whatever the compounds from inside to cell will not be diffused through the cell, and this leads to the leakage of cellular contents, and thereby the cell death occurs, and it binds to the eukaryotic cell to some extent. Now let us see the other process, inhibition of synthesis of essential metabolites. So here there are some essential metabolic compounds which are involved in the cell wall synthesis, or which are involved in the division of this microorganism. So let us see how these essential metabolites are inhibited. So these are the antiviral drugs, are those which inhibit the synthesis of the essential metabolites. So here these are very effective against limited group of diseases. So antiviral drugs are not used against many diseases. These drug usage is very limited, and these are the targets for antiviral drugs are the viral reproduction. So these are used against virus reproduction, and they are very effective against the viral infection. These drugs inhibit the nucleic acid synthesis, nucleoside and nucleotide analogs. Here there are various nucleotides and nucleosides. So here the nucleosides which are present in the DNA are the adenine, guanine, cytosine and thymine. So without these nucleotides, the DNA synthesis is not formed. So here if these nucleotide synthesis is inhibited, thereby the DNA synthesis is inhibited. The drugs like acyclovir, which is very useful against against genital herpes, and cidofovir, which is used against the cytomegaloviral infections, the cytomegalovirus. So they are very effective against these viral infections of eye. And lamivudine is a drug which is used against the hepatitis B virus. Let us see the acyclovir. So acyclovir is having selective toxicity. So it is toxic to the selective viruses, and the viral enzymes have much affinity towards this drug than the host enzymes. So here if we take the acyclovir, so the viral enzymes which are there, the viral hormones which are there, they are having greater attraction to acyclovir than the human hormones. Thereby this drug is not that toxic to the human body, and this is very effective against the HSV virus, that is the herpes simplex virus, and but it does not eradicate them. It will not kill, it will only inhibit that virus, and it needs higher doses to treat shingles. So in this condition the drug should be given in higher doses. If we see the mechanism of action, so this acyclovir, it utilizes the ATP, and it with the help of an enzyme called thymidine kinase. So here it is converted to acyclovir phosphate, and this acyclovir phosphate with the help of human enzymes, it is converted to acyclovir triphosphate, and it inhibits the DNA polymerase enzyme of that virus, herpes simplex virus, forming acyclovir triphosphate incorporated into DNA. So here it gets incorporated into the DNA virus, and thereby it causes or it inhibits the DNA synthesis. The other drug is ganciclovir. Ganciclovir is toxic when compared to the acyclovir. It may cause neutropenia, in the sense it will reduce the neutrophil count, and it is given only if the CM viruses infections are more. So it can be given only if cytomegalovirus infections are more. So if the infections which are caused by these viruses are in severe conditions, in that condition we can give ganciclovir in immunosuppressed patients who are having low immune power, and the cytomegalovirus is resistant to the acyclovir. So acyclovir, this virus can cause resistance to the acyclovir but not ganciclovir. The other antiretroviral drugs include the drugs like tenofovir, zidovudine, stavudine, didenosine, zalcitabine, nevirapine, and efivarin. So these are all the drugs which are used to control or treat the HIV. And there are other enzyme inhibitors like zanamivir. So this is zanamivir and oseltamivir. So these are the drugs which inhibit the enzyme called neuraminidase. So this is a very important enzyme which is used in the de novo protein synthesis pathway. So this pathway which is involved in the protein synthesis or DNA synthesis, that is inhibited by these drugs, and they are used to treat influenza. And Indiandentalacademy is a drug which inhibits the synthesis of the viral proteins. So the viral proteins, so the proteins which are involved in the cell wall synthesis or DNA synthesis of the virus, that will be inhibited by the drug called as Indiandentalacademy. There are other drug compounds like interferons. So interferons are the one which are also showing antibiotic effect. So here cells infected by a virus often produce interferons. So here the cells, a virus which is invading some cell, so those cells, they may produce some interferons. So these interferons, they inhibit the further spread of infection. And there are alpha interferons and beta interferons. These alpha interferons are used to treat the viral hepatitis infection. The infection which is caused because of the hepatitis, that can be inhibited by this alpha interferons. So if we see the diagrammatic representation here, the cell which is there, the cell which is infected by the virus. So here the virus RNA is there, and the virus RNA, it is undergoing, it is converting to the DNA with the help of reverse transcription. And here because of that, the cell may cause the integrins, or the cell may produce the interferons. Thereby they prevent this reverse transcription process, and thereby they spread thereby they prevent the spread of the infection. Now, why the antimicrobials are causing resistance? So why these compounds are resistant to few microorganisms? So the drug resistance limits use of all known antimicrobials. So if the drug is showing resistance, So we can't, we can't discover all the time new antibiotics, right? So we need to make sure, that the microorganism will not be resistant to this drug which we are prescribing. So for that we need to give combinations, or we need to increase the dose. So penicillin G, first introduced, it is only active against, or else we can say it is only resistant against 3% of bacteria. But now it is resistant more than 90% of the bacteria. So bacterial resistance. So why the resistance is caused by the bacteria? Because it inactivates the enzymes that destroy the drug. So here the drug which is there, or else the bacteria which is there, it will inactivate the enzymes. So these antibiotics will inactivate the enzyme which destroy the drug, and they decrease the drug accumulation. And because of this bacterial resistance, the drug which has to be accumulated in the body, that will be reduced, and thereby the drug will be eliminated out of the body, and it will alter the binding sites. So here the bacteria which are there, they are producing resistance because the bacteria change their structure, and thereby the drug will not have the binding site to the bacteria, and thereby the drug remains in the body inactive. And development of alternative metabolic pathways. So the bacteria will develop alternative metabolic pathways, and thereby the drug is not that effective against the bacteria. And if we see here, the antibiotic targets are mainly cell wall, DNA synthesis, folate synthesis, cell membrane synthesis, and protein synthesis. And these antibiotics are resistant because they cause efflux. Of these, the efflux of these drugs into the cell, and immunity and bypass. So here they are having immunity, in the sense they are developing resistance against the immunity, and the target modification, where the what we have to do is, like, in order to prevent the resistance of bacteria, we need to develop, or we need to increase the concentration of these antibiotics. Thereby the antibiotics efflux is there into the cell, and thereby we need to produce the antibiotics which show another route of inhibiting the cell wall synthesis. And target modification. So if we see the antibiotics are targeting DNA synthesis, cell wall synthesis, so we should modify the target synthesis. So if one drug is inhibiting the cell wall synthesis, we should make that drug which act through another mechanism of action. So a slight structural change brings the difference in the mechanism of action. So we need to put some modifications in the antibiotics in order to protect the antibiotic to become resistant against the bacteria.